Hey everyone, Lana here. So I was a little premature on the hitting the live button. Uh, didn't even have my headphones in yet. Welcome to another Wellness Wednesday. I'll just give a couple minutes here to let some folks tune in. Um, Tonight's topic is all about scars. Scars fascinate me. I deal with them all the time in my practice, and I'm excited to share with you what I know. So before I get going, I just wanted to take a little bit of time to introduce what Wellness Wednesdays are and introduce myself. So Wellness Wednesdays are my weekly show where I go live every Wednesday, 5 o'clock p.m., and talk about different topics that come up in the group, basically that are holding women back from being their most active and awesome selves. Um, Tonight, we're going to be talking about scars. On December 11th, we are going to be doing a live webinar, actually, on surviving the silly season. So if anybody did the reset from a few weeks ago, we're just basically going to do a little crash course in the reset, but just focused on the holiday season, how to make it through without totally falling off the wagon. I don't know if you're anything like me. I just like turn into a sloth, where sloth days are good, but sometimes you actually also want to be active. And on December 18th, this was a suggestion from someone in the group, exercising for bone health. So I know a lot of us, as we get older, or even different health conditions, different medications we're on, puts us at a higher risk for bone density loss and osteopenia and osteoporosis. So I'm going to do a little quick Wellness Wednesday on how to exercise to keep our bones healthy. But tonight, like I said, we're talking about scars and how scars can actually be causing you pain. One thing I want to do before I move on, if you know any women who would be interested in any of these topics, who would benefit from being part of the hub, please send them a message and invite them to join the group. I would love to see this wonderful little community of ours grow. So tonight, scars. If you have chronic pain that doesn't go away, no matter how many massages you get, how many times you go to the doctor and complain about it, you go to the chiropractor, all these things, and they do not go away, okay? You'll totally get something out of this session. If you have had a C-section or other scars or piercings, this is for you. Or if you know people who have, I know, you might have a sister or a mother or someone who has had like a C-section scar, you might be able to share some information with them. All right, so for those of you who don't know me, my name is Lana Welshman. I'm a clinical exercise physiologist. I almost forgot my title. I'm an active rehab specialist, and I am a neurokinetic therapist. So tonight we're going to talk a lot on the neurokinetic therapy side of things. So this is what I do mostly with my in-person clients. I love helping people reclaim their fitness after pain and injury. And I really specialize in helping people find the causes and sources of their pain and helping them connect sort of past injuries, past experiences with what they're currently experiencing today. That is sort of my jam. I love doing that. I'm just going to hit mute because I forgot to, and my headphones just dinged in my ear. All right, so I chose this topic today because most people do not have any idea the effect that scars have on their bodies. They think that once the scars healed, like after you've had surgery and the doctor says you're all healed up, you are good to go. That's just not true. Last week, we also did a Wellness Wednesday on reclaiming your body after baby. and we talked a little bit about the effect that C-section scars have on you. We're gonna, that's why I chose to do this tonight. And we're gonna talk about the effects that your scar has on your movement and on your pain and on your body. First of all, I love doing these live sessions, so if you're watching the replay or joining me live, just drop a hello in the comments, ask me questions both during the live and afterwards. I love getting questions, and don't hesitate to ask me questions like after the fact. It could be like, you know, months after I've done this live. Keep asking me questions. So tonight, what I'm going to be talking about is based in neurokinetic therapy. And neurokinetic therapy basically links your sort of your current pain to past experiences and past injuries. It's based on what's called the motor control theory, and your motor control center of your body, which is in your brain, both interprets information that it receives from like your nerves and your receptors in your body. So it takes that information in, and then it outputs information. It helps you to coordinate movement. So this is what neurokinetic therapy is based on. One thing I love, I just wanted to share my story about my own scars and neurokinetic therapy. I dealt with chronic neck pain since I was, I don't know, maybe 10 years old, so probably a good 30 years, 25, 30 years dealing with chronic ongoing neck pain. Jabbing, I had one of those hook things. I would just jab in my neck and my shoulder constantly. It never went away. This is probably one of the main reasons I went into kinesiology and into rehab was because of my neck and trying to figure out why it hurt so freaking bad. Then last year, the year before, I started getting into neurokinetic therapy and NKT, and they talk a lot about scars. And during my my training weekend, so one of the sessions, they were working on my neck, trying to figure things out, and then they said somebody noticed something weird with my chin, and it clicked in. I'm like, oh, that time I flew off the bars when I was 8 years old and cracked my chin on my knee. I have a scar I don't really think about anymore, cracked a tooth in half, spit it out, but I had the scar underneath my chin. And through testing, which is done in neurokinetic therapy, they found that my scar was affecting that spot in the back of my neck. And actually, when they released the scar, I could feel it right in the back of my neck. And I released the scar, did a little treatment, and I have not had that neck pain in about a year and a half, which is kind of a freaking miracle. So this is commonly what I see in a lot of my own clients that I treat. So your scars can affect your motor control center and can affect how your body creates movement and stabilizes joints. So we're going to talk a little bit about what a scar is and how it can affect your body. So a scar is like an injury to your soft tissues, either through like a cut or surgery. I'm sure lots of us have scars. And after that injury, your body repairs that area by laying down collagen tissues on top of it in kind of like a crisscross pattern. So it starts off crisscross, and then over the next few months and years, your body will remodel those fibers. So ideally, they realign like your normal fibers, which will be able to slide past each other. But of course, it never heals exactly the way it used to be. So sometimes you get sort of scars that don't move, or they won't move in one direction. If you have a scar and you feel it, it might feel a little bit different than the skin and the tissue and the fascia around it. So if you have a scar, just feel it. Feel how it feels different. Scars can reduce the range of motion in that area, so it can limit how much a joint can move or how much that fascia can move. It also can compress structures. So I don't know if anybody has a scar in like an ankle or something. Sometimes it like can push against the bone. cause some issues there. I've had friends who've had scarred ribs. It sort of compresses in between the ribs. And also so it can compress, and it also limits movement. The other thing that scars do is it affects the receptors that are actually in our skin and fascia. So these receptors are what our motor control center uses to take information in. So if an area is affected with a scar, your brain is not getting the information, the full information from that area. Okay? So it's not quite receiving all the information it needs. Also, it affects how your body outputs that information. So you're trying to coordinate walking, your brain is taking in all the information from those receptors used in walking, and in trying to coordinate that movement, it might not be able to send the message back to that area. And as a result, might have to use another muscle or another area to help compensate that movement or help stabilize that area. So those scars can both affect the intake of information and how we coordinate that movement back out. Scars also can affect those receptors by making that area numb. So it might shut those receptors down, so you don't get as much information, maybe don't feel as much pain, or if you might rub the area, it might feel numb. Or that scar might dial up that information. So you're getting too much information from that area. So you rub it and it's really sensitive and it's kind of irritable, like you don't like it being touched. So just keep in mind that your scars can affect that information, how it's being both interpreted and sent back out. So it's interpreted and received. Also keep in mind that scars are not just what you see on the surface. If you have had like an abdominal scar, like a C-section scar or an appendectomy, anything like that, they're cutting through layers of like skin, fascia, fat, muscle. There's layers and layers and layers, and all of those layers will form their own scars. So if you have like a C-section scar or any type of scar, you can try pushing into it and you might feel a bit more adhesion, like deeper down. It might just feel different. So just something to keep in mind, that these scars are not just on the surface. All right, so that's my little rundown on what a scar is. So how does this scar affect how you move, and how can this possibly cause you pain? So because a scar has the potential to change how your brain and how your motor control center receives and outputs information, it can lead to some areas of your body or some muscles in your body being neurologically affected by that scar. So your brain might, I always explain it like when your brain can't find that pathway that it usually uses to coordinate that movement, it's going to find alternative pathways. So it might use a different muscle, okay? It might shut down a muscle because you've just cut through layers and layers. So you've cut through your transverse abdominis to have a C-section, that muscle is going to be neurologically inhibited. It's not going to fire like it normally fires, okay? So that scar might shut down that muscle, okay? So that scar might, so it'll shut down that muscle, and then as a result, so your transverse abdominis, as an example, is the muscle, I'm just going to turn this down so you can see, it's the muscle that, you still can't see, it's the muscle that stabilizes your lumbar spine in the sort of, by surrounding your lumbar spine like a weight belt. So if you cut through that muscle's not going to fire properly, but your body still needs to do something to keep your low back stable, to keep you upright and moving around. So it's going to find an alternative pathway in order for you to accomplish that movement. So it might do a few things. Maybe it's going to recruit one of your low back muscles, like your multifidus or something, which are one of the muscles that kind of run along your spine. And because that muscle is either being overworked or doing a job it's not designed to do, it is going to be prone to overuse injuries. So it's going to get sore, might get tight. It could lead to like a tendinopathy within that muscle. So because muscle A, your transverse abdominis, has been inhibited by that scar, your body's now finding an alternative pathway to accomplish movement. It also might do things like compress a joint. So I don't know any women post-pregnancy out there who might have SI joint issues. Your body might use a joint to create stability. It might do a whole bunch of different things, but that scar is the root cause of other things that are happening. So that's kind of the effect that a scar can have on your body neurologically. I hope I explained that all right. If you guys have any questions, please post away. So what do you do with this information now? So if you had a scar and you have pain of some sort, how do you know that your scar is related to this pain? Well, the best thing you would do is to find somebody in your area who can help you with that. It's not really something you'll be able to do on your own. It takes a little bit of training, but somebody could find out if that scar is actually the source of that problem. I do something called neurokinetic therapy. There's other practitioners out there who do something called PDTR. There's a few different modalities and different techniques that can be used, but just do a little investigating. You can probably find someone who can help you out. If you don't know where to go and you have questions, you want to know, like, is this a possibility with my body and my issues? Send a comment below. Just tag me in this and I'll send you a DM or even just message me. And I don't mind hopping on a call with you, talking it out. I could even try to find a practitioner in your area that can help you make these connections. So that is pretty much my live tonight. Quick, perfect, like 20 minutes long. This is kind of the ideal length of time. So what I want you to do next is post any questions in the comments below about tonight's live. I also want you to, like I said at the top, you know anyone who might benefit from this live tonight? Send them a message, send them a link to the hub and invite them to join. And the other thing I want you to do, if there's anything that's holding you back from being your most active and awesome self, please, I post polls every once in a while. You can fill out a poll. You can even just make a post in the hub and I can help you. I can either answer you directly in the comments, or I might even just end up doing a Wellness Wednesday on that topic. So next week, I will see you again right here, 5 o'clock Pacific time. And next week's topic is all about surviving silly season. So we are going to create a little plan to help us get through the next few weeks. Lord knows I need it. So I hope to see you next week right here in the hub. See ya.